Welcome to Part 2, The Nurse as a Leader. A nurse has various roles as a nurse leader. A nurse as a leader must clearly understand the job description, roles and responsibilities, and policies and procedures that are related to the leadership role. The nurse as a leader manages work operations, making sure they run smoothly and that well-developed formulas are applied to staffing situations, economic decisions, and other daily operations. So how do we define customer service standards? The public depends on nurses to advocate for the public's needs and interests. The complex healthcare environment has created a competitive marketplace in which home health agencies, hospitals, ambulatory clinics, and even hospice agencies compete for patients. Nurses must keep patient safety and quality first and foremost as the motivator of all plans and activities and able to survive in this competitive environment. To be effective, one must consider patient satisfaction and quality customer service. Customer service standards should be defined by the customers. So who are our customers? Well, we have internal customers and external customers. Internal customers, they are employed by the organization. They include patient care staff members, staff of other departments, administrators, social workers, dietitians, therapists, and so forth. External customers are not employed by the organization. They include patients and families, as well as physicians, payers, and other users of the facility. So let's look at Team Builder. A team is a group of people organized to accomplish work. Teams bring together a range of people with different knowledge, skills, and experiences to meet customer needs, accomplish tasks, and solve problems. Teams should create synergy through defined goals and objectives, commitment to work together, good communication, and willingness to cooperate. Nurse manager is a role model for teams. They need to respect all members of the team, value their input, clearly define team goals, define the team's decision-making authority, encourage members to develop stewardship, exhibit a personal commitment to team goals, encourage team members to help each other, provide resources necessary to accomplish these goals, teach members to exchange constructive feedback to achieve team goals, and provide relevant and timely feedback to the team. With healthcare facilities focused on cost containment, it is essential that nurses develop an understanding of resource management. Resources include personnel, time, and supplies needed to accomplish goals. Plan for the necessary resources, primarily staff and supplies, to manage the unit. Organize resources to meet identified goals. Staff appropriately as determined by patient needs and the budget plan. Maintain resource allocations within budgetary guidelines. And control by analyzing financial reports and making adjustments where necessary. Problem solving and decision making are essential skills for professional nursing practice. Decision making is not always related to a problem situation, and it's required throughout all aspects of management. Problem solving is focused on solving an immediate problem and includes a decision making step. Nursing process can be used as a guide for decision making and problem solving. Assessment: gather all information about the issue. Analysis and diagnosis: use information or data from the assessment phase to identify the specific problem. Planning: identify and weigh options for risk, consequences, positive and negative outcomes. Implementation: implement a plan. And then evaluation: ensure the problem was resolved effectively. It is more important to understand the process to solve problems rather than knowing all the answers. Change is an inevitable occurrence in healthcare organizations. It is better to become an effective change agent versus fighting the changes that may be needed based upon identified problems, advancement in new programs, improving work efficiencies, or adjusting to new mandates by regulatory agencies. The change agent is responsible for guiding people through the change process. So here are a few rules to follow when change is necessary. Should be implemented only for a good reason, should always be planned and implemented gradually, should never be unexpected or abrupt, and everyone who may be affected by the change should be involved in the planning for the change. Effective change strategies can be developed through the 3 classic stages of change identified by Lewin. Lewin's stages of change are unfreezing stage. This is the change agent promotes problem identification and encourages awareness of the need for change. Then there's the moving stage. The change agent clarifies the need to change, explores alternatives, defines goals and objectives, plans the change, and implements the change plan. And then we have the refreezing stage. The change agent integrates the change into the organization. Now let's discuss some aspects of the roles of the nurse as a manager. Remember the important components of change. Involvement. Get involved. It is important to involve all individuals, groups, or departments to have an effective and efficient change. Then we need education and training. Make sure there is adequate education and training in regards to the change, enable for individuals to understand and comply with these changes. The nurse manager is viewed as a clinical consultant. They are a resource for clinical advice. Staff members will look to the manager for advice. They also are role models for excellence in nursing care and evidence-based practice. You will also have a role as a staff developer. You will need to offer learning and training opportunities to enhance professional and personal growth for all employees. You want to make sure that they have access to resources and make sure that you plan staff development activities that meet the needs of individual staff members. You will also have the role as a mentor. You will accept responsibility to act as a mentor to new nurses, and you will recognize that mentoring is key to developing future nursing leaders and managers. Besides being a supporter of staff, you will also be a corporate supporter. You are committed to the mission, the goals, and the objectives of the employing organization. You will be a professional representative for the organization. This concludes part 2 of the Nurse as a Leader. If you have any questions related to course content, notify your instructor.